In this section, I will explain how the WHO estimated the global excess mortality of COVID-19 by comparing the observed and expected deaths in 2020 and 2021, and adjusting for other factors that affected mortality during the pandemic. Excess mortality is a term used in epidemiology and public health that refers to the number of deaths from all causes during a crisis above and beyond what we would have expected to see under normal conditions. It captures not only the confirmed deaths, but also COVID-19 deaths that were not correctly diagnosed and reported, as well as deaths from other causes that are attributable to the overall crisis conditions. To estimate the global excess mortality of COVID-19, the WHO used a variety of statistical methods and data sources, including civil registration and vital statistics systems, health information systems, surveys, censuses, and modeling. The WHO also collaborated with the United Nations Department of Economic and Social Affairs, UNDESA, and convened a Technical Advisory Group, TAG, on COVID-19 mortality assessment to develop harmonized methods for excess mortality and help determine the total number of direct and indirect deaths attributable to COVID-19. The main steps involved in estimating the global excess mortality of COVID-19 were as follows. First, the WHO collected data on the reported number of deaths from all causes in each country or region for each week or month, depending on the data availability, in 2020 and 2021. Second, the WHO estimated the expected number of deaths for each country or region for each period had the COVID-19 pandemic not occurred. This was done by fitting a regression model using historical deaths data from 2015 to 2019 and projecting the number of deaths for 2020 and 2021 based on seasonal variation and year-to-year trends in mortality. Third, the WHO calculated the excess mortality for each country or region for each period by subtracting the expected number of deaths from the reported number of deaths. The excess mortality was then aggregated across countries or regions to obtain the global excess mortality. Fourth, the WHO adjusted the global excess mortality for other factors that affected mortality during the pandemic, such as natural disasters, conflicts, or changes in population size and age structure. This was done by applying correction factors based on expert judgment and available evidence. Using this approach, the WHO estimated that the global excess mortality associated with COVID-19 was 14.9 million in the 24 months between January 1, 2020 and December 31, 2021, representing 9.5 million more deaths than those globally reported as directly attributable to COVID-19. This means that the true death toll of COVID-19 was about 300% higher than the official count. This estimate is subject to uncertainty and limitations, such as data quality and availability, methodological assumptions, and potential biases. The WHO acknowledges that there is no single definitive way to measure excess mortality, and that different methods may yield different results. Therefore, the WHO encourages countries to conduct their own excess mortality analyses using their own data sources and methods. The global excess mortality estimate is an important indicator of the total impact of the pandemic on deaths. It helps to monitor the evolution of the pandemic, evaluate its severity, identify its direct and indirect effects, assess its social and economic consequences, and inform policy responses. In this section, we will discuss the main findings of the WHO report that estimated the global excess mortality due to the COVID-19 pandemic in 2020 and 2021. Excess mortality is defined as the difference in the total number of deaths in a crisis compared to those expected under normal conditions. It accounts for both the direct and indirect impact of the pandemic, such as disruption to essential health services or travel restrictions. According to the report, the true death toll of COVID-19 was at least 14.9 million, ranged 13.3 million to 16.6 million, between January 2020 and December 2021, which is more than double the reported number of 6.9 million. This means that about 8 million deaths were not officially attributed to COVID-19, either because of limited testing capacity, different reporting methods, or delayed registration of deaths. The report also revealed significant regional variations in excess mortality. The region of the Americas and the European region had the highest excess mortality estimates, with about 60% and 50% more deaths than reported COVID-19 deaths, respectively. The African region and the Eastern Mediterranean region had lower excess mortality estimates, with about 30% and 20% more deaths than reported COVID-19 deaths, respectively. The Southeast Asia region and the Western Pacific region had similar excess mortality and reported COVID-19 death estimates. The report highlighted some of the limitations of official COVID-19 death counts, such as incomplete or delayed registration of deaths, lack of standardized definitions and classifications of COVID-19 deaths, and variation in testing and reporting practices across countries. It also acknowledged some of the challenges and uncertainties in estimating excess mortality, such as data quality and availability, seasonal patterns and trends, demographic factors, and potential confounding factors. The report concluded that excess mortality is a more accurate measure of the true impact of the pandemic than reported COVID-19 deaths alone. It also emphasized the need for strengthening civil registration and vital statistics systems, improving data collection and analysis methods, and enhancing collaboration and coordination among stakeholders. The report called for urgent action to prevent further deaths and suffering from COVID-19 and its consequences, by increasing vaccination coverage, maintaining public health measures, ensuring equitable access to health services and resources, and addressing the social and economic determinants of health.